You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. My first guest is an expert on the topic, periodontist Dr. Singh. Dr. Singh, welcome to the program.
Thank you, Randy. It's a pleasure.
Now, you are in one of the busiest centers in Chicago.
That is correct.
And you're a periodontist. What's a periodontist, by the way?
A periodontist is actually a dental specialist who specializes in the treatment of what's called periodontal disease or gum disease.
Now, you've been in and around dental implants for quite some time.
I finished my surgical training in the late 90s, and I've been placing implants for almost 10 years now.
Your background, your training, head of your dental class, also you are part of the advisory board with Nobel Biocare. And what is that role? I mean, it's the biggest implant company in the world.
It is. Nobel Biocare is the most researched and the largest implant company in the world, and it's a little bit of an honor to be part of that advisory board, but it's also my pleasure.
Now, you have a team approach there. I mean, all the specialists at the implant center are all under, implant solutions, I should say, are all under one roof.
Yeah.
What's the big benefit to the patient?
You know, it's a huge benefit because the traditional approach 5-7 years ago is you go to your general dentist, the general dentist then sends you off to a surgical specialist, then you have to drive from the surgical specialist to another place to take special x-rays, come back to the surgical specialist and go back to the general dentist. Well, half the time the patients get lost, lost in the shuffle. Yeah. Our center offers an all-in-one state-of-the-art facility to provide comprehensive care for these patients.
Oral surgeon, periodontist, prosthodontist. What's a prosthodontist, by the way?
Prosthodontist is a dentist who specializes in complex, in restoring more complex cases.
What does that mean, restoring, by the way? Putting the teeth on the...
Yeah, giving you teeth. I mean, a general dentist can... It's easy for a general dentist to fix one tooth, but when you have a complex problem, it's better for you as a patient, in my professional opinion, to go see someone who's got further training in dealing with more complex issues.
Okay, as far as a specialist, how important is it if you're going to get dental implants to see a specialist, and does it cost more to go to a specialist?
Well, two things. Number one, I think it's extremely important if you're going to have any sort of dental implant treatment to see a specialist. You know, I give all my patients a simple analogy. If you sprain your ankle, go to your general doctor, your family doctor, they wrap it up, give you some Advil, you know. But if you blow out your knee, okay, and you're a hockey player or a basketball player, you know, you go to an orthopedic surgeon, you know, because he specializes in knee reconstructive surgery. It's the same thing. If you need special implant treatment or if you need special surgical therapy, you need to go to people that have proper training.
So Implant Solutions Center. So this is your focus. Even though it's not a recognized specialty, this is your specialty.
Absolutely.
Okay. So what are the categories of patients that you see for dental implants?
Well, Randy, you can categorize patients into several subsets. The first one is a person missing one tooth.
Okay.
The second one is a person missing a couple teeth, where you can have traditional bridge work or partial dentures with the metal wires that wiggle and wobble in your mouth. The third set of people are people that are missing all their teeth. And they have what Grandma and Grandpa used to have, those dentures. And I remember my grandma taking her dentures out and, you know, pretty much not enjoying life. The fourth set of patients are those that are been told by their dentist, listen, we don't have much we can do for your teeth, and you have to have them all out. And those are the ones that we really pride ourselves on.
So your teeth have to go. What if somebody has bad gums? Can they still be candidates, like, you know, anticipating this interview? Somebody said, my gums are terrible, Randy, my teeth have to go.
Absolutely. As a periodontist, I treat periodontal disease, or bad gums, as you said. So what we would do is we would arrest the disease process, make sure that was under control, and then we can proceed with implant treatment. Do it all the time.
They're candidates as well.
Absolutely.
You know, we talked a little off camera. You said, Randy, the people I'd like to see more of is the baby boomers that are missing 3 and 4 teeth. Why?
Randy, it's amazing that you asked me this question, because what I see all the time is what I call like a snowball effect. Patients come to me and they say, Doc, I'm missing all my back teeth, or I've got these problems. And I always ask them, how did this start? Well, I lost my first tooth when I was 30, 35 years old. You know, didn't think anything of it in the back of my mouth, and lost a couple more on the other side because I was chewing more on that side. Yeah. And then I started chewing with my front teeth, and now I'm starting to lose my front teeth. Now I got this big problem.
Does that really happen, though?
Absolutely.
So you miss 2 teeth in the back, it affects other teeth.
You know, God created us all a special way, and He gave us back teeth, the molars, the big ones, to chew with, and He gave us the front teeth to bite with. I tell all my patients, you bite apples with your front teeth, you chew them up with your back ones. So if you start losing a couple back teeth, people think, it's not a cosmetic concern. It's okay. I still have my front teeth.
So they get a bridge or partial in most cases, these
people?
Or
sometimes they do nothing. But yes, sometimes they'll get a bridge, sometimes they get a partial, but even those are adding stresses to the existing teeth.
So what do you say to that crowd out there? They're out there, they have bridges, they have partials in their mouth.
Keep life simple. If you've got a problem, fix it before it progressively gets worse.
So dental implants is that solution, in your opinion?
Absolutely.
If they don't do it, what happens?
If they don't do it, then they're going to be running into further problems. You lose one tooth, studies by the American Dental Association will show it. You lose a tooth, don't replace it, you're guaranteed to pretty much lose 2, 3, 4 more teeth. It's not going to happen the next day, but over the next couple of years, you will lose more teeth.
Okay. Now, moving on to the denture wear, and I know you have photos.
I do.
The denture wear, though, you say two dental implants can give somebody something that they could snap in as far as a lower denture?
Absolutely. I always remember my grandmother. My grandmother never wore her lower denture except when she wanted to eat a little bit. But what happens is the denture over time starts to get loose because your bone starts to atrophy. If you broke your leg, didn't walk on your leg, there's no stimulation to the bone, and hence the bone atrophies away. In the same way, if you lose your teeth and don't stimulate the jawbone, the bone shrinks away. You start to sag, your face starts to sag, and the denture starts to get loose. Not because the denture is changing, because the gums and the bone are shrinking underneath it. Hence, if you give yourself a little bit of support with the minimum of 2 implants, I recommend 4 to 6 typically to give a little more support. 4, 6 is the best, the gold standard treatment. 2 is better.
So for a denture wear, 4 implants in the lower jaw, and they could have something fixed in the right candidate.
Absolutely. You can have 4 implants, and you can have a removable appliance, which will be, you can bite into apples, you can bite, I tell my patients you can bite into corn on the cob, heck, you can bite the bark off a tree. Okay. You know, with 4 implants. With 2 implants, you'll be chewing comfortably, it won't be moving on you, you'll feel good about yourself.
You call this all on 4. This is the all on 4 procedure we're talking about.
Absolutely.
So one day, how could it be done in one day?
Well, Randy,
and they could chew, you say?
Yeah, and they can chew. In one day, a patient can come to me.
So denture wear, let's say.
A denture wear, or a patient that has teeth that are just hopeless, that they're wiggling and wobbling, and they don't look right, they don't look straight, and they're hurting you. In one day, we are able to have a patient walk out looking good, feeling good, and feeling confident about themselves. Able to chew, talk, and smile with confidence.
Something fixed or something snaps in, snaps out?
Something fixed, permanently in their mouth, like their own natural teeth, better than what they had when they started.
Yeah, you brought some photos. You say you're changing people's lives.
I definitely feel that way.
How so, by the way?
You know, let me show you this case here. This lady came to me in her early 60s and was very unhappy with the appearance of her teeth, the function of her teeth, and just was unable to tolerate any sort of removable appliances. Her mouth was basically falling apart.
Okay, so this after that I'm looking at, it's like a fixed?
It's a fixed prosthesis. This bridge that she has in her mouth is supported by 8 implants. So she has 12 teeth supported right now by 8 implants, and she's able to walk, smile, and talk with confidence in the same day.
Okay.
But I want you to look at something, Randy. Look at the before and after pictures. Look at the smile. Now, yes, you can see that the after photo, the smile is much prettier, much more aesthetically pleasing. But and I was going to get to that, Randy. It has to be age appropriate. If I gave her a bright white smile of a 19-year-old model, it's not going to look natural on her, and people will be able to tell that it's fake. We want to give you a solution that makes you feel confident, comfortable, but also feel good about yourself.
So it changes their life. You say they become more social. It raises their self-esteem. Just because they were missing teeth and now they get their teeth back, Randy, you see differences with these
Randy,
people.
There's studies out there by marketing gurus that'll say, what's the first thing you look at when you talk to someone?
Eyes and teeth, I guess.
Your mouth. You're talking. That's what you're looking at. You're trying to look right at the mouth. And when you don't feel comfortable with the way your smile is and the way you talk, you know, you lose confidence. Not only do you lose confidence in just communicating with people, but you lose confidence in eating and chewing. People that have dentures, they taste the metal. The dentures wiggle and wobble when they chew it. They don't feel comfortable eating. You lose some of the things that we take for granted. Patients, they tell me they wish they did it so much sooner. They rave about, they tell me how tolerable the procedure was and what a difference it's made in their...
So pain is not something they complain about?
No, not at all. It's a very tolerable procedure, and the majority of my patients say it's just like going to the dentist for a regular filling or routine dental treatment.
Okay, if it's as good as you say it is, okay, for the denture wear, for anybody missing teeth, why isn't everybody doing it?
In my professional opinion, I just think that people don't know about it. Everyone knows what a denture is, and people are afraid about getting dentures. So the average person that's out there says, Grandma, Grandpa had dentures, or my great-grandparents had dentures, and they hated them.
But don't people wait until the last minute to do something? It's tough to get those people in.
The human population is inherently like that. We always wait till we can't do anything else. It's better to get in and fix the problem before it escalates.
Okay, now we have time for probably one more photo. What else do you have?
Randy, let me just show you this one case that I think is really telling. This patient presented to me and she had a partial denture. She hated it because when she smiled, the metal wires were showing. When she ate, it wiggled and wobbled in her mouth, and she just wasn't comfortable. And the worst thing it was doing was the denture, the wires were wrapping around her natural teeth, and it was making those teeth get weak.
Okay.
So she came to me, and in one day we were able to place dental implants and have her walk out the same day with a beautiful new smile.
So something fixed.
Something permanently in her mouth that doesn't come in and out.
And they look very natural. Excellent work. Final message, we're out of time. Somebody watching this, they're missing a tooth.
Randy, the one thing that I have to say to everyone out there watching today is if you are missing teeth, if you know you've got teeth that have to come out, or if you've got problems in your mouth, you know, come in and do yourself the service of researching the options about dental implants, because they are the gold standard for tooth replacement today.
I want to thank you for coming on the show. Very good, very interesting. By the way, we have 2 more dentist from your practice, the whole team here today. Up next, Dr. Coos. What is his role there? Similar to yours?
Yes, Dr. Coos is another surgeon in our practice. He's actually an oral and maxillofacial surgeon. Chicago's a big area. We have a lot of patients knocking down our doors, and Dr. Coos is another surgeon that helps in the placement of implants at our practice.
All right. Well, thanks again for coming on the show.
Thank you very much, Randy.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Up next, more about the dental implant process. We'll be right back.